Good afternoon, everybody. The last briefing that I was with you was on Friday, July 31st. Since then, we've announced 3 new cases of COVID-19. 2 of those were on August 2nd, and both of those cases have since resolved, and the follow-up of those cases has been concluded. Today, we're announcing 1 new case of COVID-19 in the northern zone. This case remains under investigation by public health, and we'll be able to share more information with you when that is available. So to date in Nova Scotia, we've had 1,072 cases of COVID-19. We've had 67,712 people who have been tested with a negative result, and have had 64 deaths. Yesterday, the QE2 Health Sciences Center's microbiology lab completed 582 tests. So overall, our COVID-19 case numbers remain low and infrequent, and it's where we would like them to stay. But we have to remember, since July 1st, we have had 10 new cases. We are announcing a new case today. So it's a reminder that COVID-19 is not gone. That we have to, as in the minister's words, we have to remain vigilant, and that there's that people can't assume that we can relax on the measures that all of us need to be taking. We still have a long way to go in regards to COVID, but we are where we are because people have collectively committed the hard work and following the rules, and we need to continue to do that, because that is what will minimize the risk of COVID-19 in our communities. And one of the ways the most important way we can keep our schools open and keep our schools safe is to have low COVID in our communities. So keeping our schools safe is actually something that's in all of our hands together that we need to work on. So as Minister Churchill said, that it is important that our children are able to be in school, not just for their academic learning, but also for their social and psychological development. That is a consensus amongst public health and amongst the pediatric community, that children need to be able to be in school for their overall health and well-being and development. So we need to balance the safety measures that are necessary for COVID-19 with that need for children to be in school. I recognize that the situation around school may be creating fear and anxiety for parents, students, and teachers. This is actually quite normal. We are in a pandemic. There is a lot of uncertainty, and we did have to have a very strong response to the first wave. So if you're feeling anxious, feeling fearful, the first thing is to remind yourself that that's okay and that's normal. However, COVID-19 is here for a long time, and we need to learn to live our life, balancing COVID safety while allowing, as much as possible, aspects of our daily life, including learning environments, to continue. The school reentry plan provides an appropriate balance of allowing in-class learning while applying the necessary public health measures in a layered and complementary approach. It is also flexible and will adapt if and when our local epidemiology changes. The 100% approach is based on maintaining a low level of COVID-19 activity. And I think that seems to be forgotten by a lot of people, that the current approach that we're opening schools with is based on our current level of epidemiology. And if that epidemiology changes, either in a local area or across the province, the school plan changes, the strength of the public health measures increase. And so we have a flexible, adaptable plan that allows the appropriate level of safety, finding the balance between COVID safety and allowing learning to happen in the best way possible. The plan will also be flexible as our knowledge evolves. So, for example, since releasing the plan just a few weeks ago, the advice and the evidence has changed on masking. And that's why today the plan has been amended to require masks for students in grades 4 and up, except when students are seated in their classrooms and are facing forward 2 meters apart. If they're able to do that, then they are able to take the masks off in their classroom, only in those circumstances. This change is based on new guidelines released by the Public Health Agency of Canada. They now recommend masks for children ages 10 and up because it's that age group that may be as likely as adults to transmit the virus. Children under the age of 10 are much less likely to transmit COVID-19. And the national recommendation, which is aligned with international recommendations, is because of that much lower risk of transmission, younger children under age 10, we're not saying need to wear a mask in the classroom. They do need to wear a mask on buses and when they're in hallways in schools. So that changing evidence is why it now makes sense to protect our school communities by adding in the requirement for masking in classrooms for grades 4 and up. I fully endorse this policy, and it is consistent with, as I've said, the public health guidance nationally and in other provinces. The minister also noted that the province is supplying masks to schools, which is important. We need to make sure we have access. Anybody who has their own proper non-medical mask, we encourage them to wear it to school if they're on a bus, or bring it to school with them. But every student, teacher, and staff member will be given 2 reusable non-medical masks at the start of the school year. There will also be disposable masks available in schools for various reasons if people do not have a mask. There will be situations where individuals have a valid medical reason for not wearing a mask, and that reason will be respected. We all need to be respectful of people who have situations that do not allow them to wear a mask. So the important thing now to encourage families and parents is to help our children to get comfortable wearing a mask. Don't wait until the day before school to have them to start to learn how to wear a mask. And now they have to wear it in indoor public places. So it's a perfect opportunity to, as a family, get comfortable with having a mask on, learning how to take it on and off properly and safely. I've certainly been encouraged by how quickly Nova Scotians have embraced the masking policy, both on buses and in indoor public places, and I want to thank Nova Scotians for that. It's becoming quite unusual to see somebody without a mask in an indoor public place, and I think is an indication of my belief, as I've said here before, that if we had a mandatory policy, we don't need to have strong enforcement. The majority of people will do what's necessary to keep each other safe, and I want to thank Nova Scotians for that. By doing that, you're helping normalize masks for our younger people and showing as a role model, and it'll help them to adapt to wearing masks in schools. But I want people to understand that this masking policy is just being layered on. It's an addition to the many measures that are already the public health guidance and the other public health measures that are being worked on and implemented as part of the school reopening plan. And we'll continue to work with the Department of Education, the Regional Centers for Education, and individual schools to ensure that we have safe learning environments to welcome teachers and students back to come September. And we'll continue to be at the table working with the education system as the fall evolves, as our epidemiology evolves, and as the evidence evolves around COVID-19 to adjust the plan as necessary and required. As I said earlier, I know that families and staff may be anxious about returning to school. This is normal and expected, but I do want to reassure people that that while COVID-19 may be new, the established public health protocols that we use to respond to communicable diseases are not new. They are the same approaches that we have used for a long period of time and are well versed in public health, whether it's pertussis or whooping cough, measles, chickenpox, are steps that we take in terms of identifying cases and contacts, taking the necessary protective steps for schools, with our education partners. We have lots of experience with that, and it's how we've also been responding to COVID-19 in other community settings, and so it's. I think I want people to understand that how we'll be approaching COVID-19 in our school setting. Public health is well versed in this and applying a COVID-specific lens to it. We have a lot of experience and expertise in this. If a case is identified in a school, public health, we will act quickly to identify and test anyone who may have come into close contact with that person. That's our normal process. And that's one of the reasons why we're keeping students in their classroom cohorts and limiting contacts between cohorts. So if we do have a case, we have a limited number of people that would be considered in terms of a close contact and require testing, and limit the number of people who may then come down with COVID themselves. If anyone tests positive, they will self-isolate at home for 14 days. People identified as close contacts will also be quarantined for 14 days. And then any additional steps will be guided by public health with the school based on the specific circumstances around that individual case. Communication to parents and families has always been and will remain a priority for the public health response when we have a notifiable disease in a school. So in closing, I just want to come back to remind all of us that the public health measures that we've all been practicing for the last 6 or more months, hand washing, cough etiquette, staying home if you're sick, maintaining physical distance as much as possible, and now more recently masks, are what really matters in keeping COVID out of low in our communities and out of our schools. The most important thing we can all do to keep our schools safe, to allow our children to be in school and our teachers to be in school, is to keep COVID rates low in our communities. And we all have a role in this. Each of us, by doing all the public health measures ourselves, I keep coming back to, it's how do we create a community that's safe for all of us. So everything we choose to do or not do has an impact on ultimately on our ability to keep schools safe. I know that we won't be able to entirely prevent new cases. I fully expect that we will get COVID cases in a school. But that doesn't mean that what we've got in place has not worked. We fully expect that to happen. But our goal is to keep our COVID cases low. And if we follow the practices that worked in the first wave and that have worked in the past to protect our school communities from other communicable diseases, we'll be able to maintain appropriate levels of safety and have our children and teachers in school as much as is possible.